Hi friends, welcome to the channel The Nurse. Here we are discussing about oncology, nursing questions and answers. Oncology, chemotherapy, radiotherapy related questions and answers. Yesterday we discussed around yesterday we discussed digestive system questions and answers, and today we have one more sessions at 9 o'clock. Um, there we will discuss critical care nursing questions and answers. That is second part. So we'll go to our topic, that is oncology nursing questions and answers with rationale. Hi Jansi, good evening. Oncology nursing questions and answers with rationale. Hi Surya, Lisha, Deepthi, good evening. Lalus, hi. Sanila, Nandani, Jyoti, Simran, Nandani. Good evening to all. We will start here because we have two sessions. Need to prepare for next session also. So we will start here. Hi Shalini. So before going to start, I need to inform you that that is Unacademy's Master Stroke course, that is for preparing JNU, Manipal or IIT JAM 2021 entrance exam. Master Stroke course that is started by Unacademy. So you can prepare for JNU, Manipal University or IIT JAM entrance exam preparations, that is exclusively for biotechnology subject. So that course starting from 18th January. Day after tomorrow, it will start that biotechnology course, master stroke course. It will be helpful for those who are preparing for JNU Manipal University or IIT JAM 2021 entrance examinations. This biotechnology subject is handled by Madam Ankita Misra, Debashish Kar, Hari Mohan sir, and Manisha Pallavi madam. So if you are interested, you can join through my referral code. So you will get 10% discount. So another course, that is a T20 test series for IIT JAM, exclusively for IIT JAM. Those who are preparing for 2021 IIT JAM, they can assess themselves by giving T20 test series. That this one test include 20 questions. The duration of test, that will be 60 minutes. It will be a live exam. So that is all India level live exams. So if you are participating live exams means you can get your rank. All India rank you can get after the test. And also you can attend in offline mode after the live sessions. You can also attend this live test series, T20 live test series. That is, the syllabus is same like IIT JAM entrance examination. So it will be best assessment test for your IIT JAM preparations. So that course, that test series will start from 17th January 2021. That is tomorrow, 9 o'clock. The test I already told, it will be 60 minutes and includes 20 questions. So here also you can join through my referral code, that is the nurse page. You will get 20% discount. Another entrance examination, that is one of the uh, very difficult entrance examinations, that is TIFR, Tata Institute for Fundamental Research Marathon Part 11 January series. So if you are planning to attend TIFR 2021 entrance examinations, so you can join TIFR Marathon Part 11 January series. In that, highlights includes in this series, share the educators, the top educators will help you to share the magical tips, shortcut to solve any questions in less time. So time management you can make there. And next thing is giving special attention to most important topics. So they will attend all the important topics, and you will get an idea how to prepare for TIFR examination, entrance examination, that is scheduled in March 2021. Next important point is teaching the toughest concepts in simplistic ways. So that's what important to join this course. So you will get an idea and easy way to make adequate preparations. That is the highlight of the TAFR Marathon Part 11 January series. So next one, you can also you will also get live quizzes, mock tests, and many more to boost your confidence. So it will be best preparation course that is for TAFR entrance examination 2021. It is also starting from 17th January 2021. Tomorrow onwards, the TFF marathon test series will start. Course will start. That is first class 10 o'clock tomorrow 10 a.m. onwards. So you can use my referral code here also. We'll get 10% discount. So we'll go to our topic oncology nursing questions and answers with rationale. So first question, which of the following clients is at high risk for colorectal cancer? Which of the following clients is at high risk for colorectal cancer? The client who smokes, the client who eats a vegetarian diet, the client who has been treated for Crohn's disease for 20 years, the client who has a family history of lung cancer. Yesterday, a similar question we have discussed there, so you can answer here easily. Similar question discussed in yesterday. Okay, we'll check the correct answer here. The correct answer is the client who has been treated for Crohn's disease for 20 years. Yesterday we discussed the high risk clients for colorectal cancer or colon cancer, that is inflammatory bowel disease. So Crohn's disease is one of the inflammatory bowel disease. So that is history of Crohn's disease means there is a chance for high risk for colorectal cancer. Clients over age 50 who have a history of inflammatory bowel disease are at high risk for colon cancer. The client who smokes is at high risk for lung cancer, while the exact cause is not always known. Other risk factors of colon cancers are diet high in animal fats, including a large amount of red meat and fatty foods with low fiber, and the presence of colon cancer in a first generation relative. So these are the high risk for colon cancers. They are a diet high in animal fat, including a large amounts of red meat and fatty foods with low fibers, the presence of colon cancer in first generation relative. So same kind question discussed in digestive system questions and answers also. So please read these questions because it will be important. So it comes in digestive system, oncology also. This question similar questions asked. Next question, which of the following clients is at greatest risk for skin cancer? Which of the following client is at greatest risk for skin cancer? 45-year-old physician, 15-year-old high school student, 30-year-old butcher, and 60-year-old mountain biker. Second question. Okay, we'll check the correct answer. Please give your answer fast. Then only we can make this video faster. Around 30 friends are there online. Please make your answer fast. Okay, we'll check the correct answer here. Second question, correct answer is option D, that is 60-year-old mountain biker. So this patient will be high risk for skin cancers because this patient is age also that is 60. While increasing the age, the chance of cancer is increasing and is exposed to sunlight. So that is one of the uh, high risk for skin cancers. So ultraviolet radiation exposure is that is the one of the high risk for skin cancer. Basal cell carcinoma, that is a one type of skin carcinoma, occurs most commonly in sun exposed areas of the body. So basal cell carcinoma is the skin carcinoma, one type of skin carcinoma, occurs most commonly in sun exposed areas of the body. The incidence of skin cancer is highest in older people who live in the mountains or spend outdoor leisure time at higher altitudes. So mountain biker is highest risk. The person's age is 60 years. So 60-year people is one of the highest category for skin carcinoma, and same time he is exposed to sunlight. Is directly exposed to sunlight. So the another high risk, that is exposure to sunlight. That is why the 60-year-old mountain biker is a highest risk for skin cancer. Next question. Carcinogenesis is irreversible in which of the following stages? Carcinogenesis is irreversible in which of the following stages? Progression stage, promotion stage, initiation stage, regression stage. Please try to make your answer faster. Please read this question once again. Carcinogenesis is irreversible. Okay, we'll check the correct answer here. Correct answer is progression stage. In progression stage, we cannot reverse the effects of carcinoma or the progression of the cancer. So that is usually carcinogenesis is commonly divided into three stages: initiation stage, promotion stage, and final progression stage. In first initiation stage and promotion stage, we can reverse the effect, but in the last stage, progression stage, we cannot reverse the effect of carcinoma. Regression stage, that is it is not there. Only three stages are there: initiation, promotion, and progression stage. Progression is the change. Progression is the change in a tumor from a pre-neoplastic state or low degree of malignancy to a rapidly growing tumor. It cannot be reversed. So that is the third stage of carcinogenesis. In this stage, the tumor from pre-neoplastic state to pre-neoplastic state or low degree of malignancy to a rapidly growing tumor. So in this state, we cannot reverse. Promotion stage also we can reversible, and initiation, that is the starting stage. Initiation is at first reversible. So in this initiation stage, we can reversible at the first part. Then that is the through repair of damaged DNA. But in later case, we cannot reverse. So that is important in initiation stage. So first part of the initiation stage, we can reverse the effect by through repair of damaged DNA, and but in later part, we cannot reverse the effect of carcinogenesis. Regression is not a recognized stage of carcinogenesis. Okay, we'll go to next topic. And Ashok Panwar, you are selected in CHO now. So congratulations. So those who are wanted CHO rank list, they can comment here. So after this video, I will post it. Just now only Rajasthan CHO rank list announced. So one of our subscriber, that is my friend Ashok Panwar, got selected. So congratulations. So all of you give a congratulations to Mr. Ashok Panwar. We'll check next question. Experimental and epidemiologic evidence suggests that a high fiber diet increases the risk of several cancers. Which of the following cancers is linked to high fat diet? Experimental and epidemiologic evidence suggests that a high fat diet increases the risk of several cancers. Which of the following cancers is linked to high fat diet? Ovarian cancer, lung cancer, colon cancer, liver cancer. So the reason it is explained in first questions, those who are listen to that explanation, they can answer here. So I have given a clue in first question's explanation. Okay, we'll check the correct answer here. Correct answer is colon cancer. Colon cancer is linked to high fat diet. The risk for colon cancer increases with intake of high fat diet. High fat diet with low fibers. Evidence suggests that a high fat diet increases the risk of several cancers, including breast cancers, colon cancer, and prostate cancers. So, these three cancers are linked with intake of high fat diet. Ovarian, lung, and liver cancers have not been linked to a high fat diet. I think it is clear. Okay, we'll go to next question. Which of the following is an environmental factor that increases the risk of cancer? Which of the following is an environmental factor that increases the risk of cancer? Gender, nutrition, immunologic status, age. Environmental factors that increases the risk of cancer. Okay, we'll check the correct answer here. Nutrition is nutrition is under environmental factor that increases the risk of cancer. Nutrition is the one of the factor that included environmental factors increases the risk of cancers, and apart from that, gender, immunological status, age, these factors are included in which subcategory? Gender, immunologic, and age. So gender, immunologic, and immunologic status and age are included in individual factors. So nutrition included under environmental factors. Environmental factors include place of residence, nutrition, occupation, personal habits, iatrogenic factors, and physical environment. So these are the things included in environmental factors. They are place of residence, nutrition, occupation, personal habits, iatrogenic factors, and physical environment. Under individual factors included gender, immunologic status, and age. These are included in under individual factors. Next question, sixth one. A client with pancreatic cancer is receiving morphine via subcutaneous pump. The client is developing a drug tolerance. The nurse understands that the client is tolerating the medication well, showing addiction to morphine, requiring an increased dose, experiencing physical dependence. A client with pancreatic cancer is receiving morphine via subcutaneous pump. The client is developing drug tolerance. The client is. So you need to know what is drug tolerance. Then you can answer here. Drug tolerance usually seen with psychiatric patients. Okay, we'll check the correct answer here. That is requiring an increased dose. Tolerance means the usual dose. The usual dose will not be effective. So that patient required increased dose. That is tolerance. Tolerance develops from taking opioids over an extended period. It is characterized by the need for an increased dose to achieve the same degree of analgesia. Initially, for an example, if patient is getting adequate analgesia from 10 milligram of morphine, if tolerance develops means the patients needed 20 milligram or more dose to get the same degree of analgesia. That is tolerance. Patients request higher dose to get the same effect. That is what tolerance. Addiction is characterized by a drive to take the medication for a psychic effect rather than the therapeutic effect. So addiction means patients getting taking the medication for getting psychic effects rather than therapeutic effects. That is addictions. Physical dependence. Physical dependence means is a response to ongoing exposure to medications manifested by withdrawal symptoms. So if discontinued the medications means patient will show withdrawals. That is what physical dependence. Next question. A client with bone cancer pain. The client with bone cancer pain, which of the following components of a thorough pain assessment is most significant for this client? A client with bone cancer pain, which of the following components of a thorough pain assessment is most significant for this client? Intensity, cause, aggravating factors, location. So before answering your these questions, you need to think the patient is experiencing bone cancer pain. Shraddha Vidyadhar. Morphine is contraindicated. Usually, morphine is contraindicated in pancreatitis. So, that case, meperidine will give. That is for just an example only. Okay. Correct answer is intensity. The patient is already suffering bone cancer. So, in that case, the significant factor we need to assess that is intensity of the pain. Because we cannot cure the bone cancer completely. So in that case, we can assess the intensity of the pain, and we can treat to reduce the intensity. Cause, aggravating factors, locations. These are the insignificant related to bone cancer. Intensity is indicative of severity of pain and is important for evaluating the efficacy of pain management. The cause and location of the pain cannot be managed, but the intensity of the pain can be controlled. The nurse and client can collaborate to reduce aggravating factors. However, the goal will ultimately be reduce the intensity of the pain. Okay. Next question. A client is receiving external beam radiation therapy for treatment of lung cancer. A client is receiving external beam radiation therapy for treatment of lung cancer should assess the client for which of the following? Diarrhea, improved energy level, dysphagia, normal white blood cell count. Preeti Jose, it is just for an next question only. Morphine is contraindicated in pancreatitis. In the pancreatitis condition, we will use meperidine for pain management. Okay, we'll check the correct answer here. Correct answer is dysphagia. Dysphagia is one of the complication due to beam radiation therapy. The radiation-induced esophagitis with dysphagia is particularly common in clients who receive radiation to the chest. Radiation-induced esophagitis with dysphagia dysphagia means difficulty in swallowing. Dysphagia is particularly common in clients who receive radiation to the chest. The anatomic location of the esophagus is posterior to the mediastinum and is within the field of primary treatment. Diarrhea may occur with the radiation of the abdomen. Decreased energy level and decreased white blood cell counts are potential complications of radiation therapy. So, the radiation beam therapy, in radiation beam therapy, the esophagus is mostly exposed. That is why esophagitis and dysphagia is common complications in radiation induced radiation beam therapy to the chest. Next question. A 56-year-old client is receiving chemotherapy that has the potential to cause pulmonary toxicity. Which of the following symptoms indicates a toxic response to the chemotherapy? Decrease in appetite, drowsiness, spasm of the diaphragm, cough and shortness of breath. 9 question. If you are giving answer fastly means I will go fastly. Don't worry. Okay, we'll check the correct answer here. Correct answer is cough and shortness of breath. That is indicates lung toxicity due to the chemotherapy. Cough and shortness of breath, that is indicates lung toxicity due to chemotherapy. Cough and shortness of breath are significant symptoms because they may indicate decreasing pulmonary function secondary to death toxicity, which is caused by chemotherapy treatment. Decrease in appetite, difficulty in thinking clearly, and spasm of the diaphragm may occur as a result of chemotherapy. However, they are not indicative of pulmonary toxicity. Decrease in appetite, difficulty in thinking clearly, and spasm of the diaphragm may occur as a result of chemotherapy. However, they are not indicative of pulmonary toxicity. So, in question, they are asked the symptoms are related to pulmonary toxicity. Next question. The most common issue associated with sleep disturbances in the hospitalized clients with cancer is. The most common issue associated with sleep disturbances in the hospitalized client with cancer is social, nutritional, cultural, psychological. Okay, we'll check the correct answer here. Correct answer is psychological. That is, everyone knows psychological condition is most disturbing factor for hospitalized patients that makes insomnia. Most hospitalized persons are risk for sleep disturbances. Psychological issues such as anxiety and depressions and pain are related to sleep deprivations. Social, nutritional, and cultural issues are not necessarily associated with sleep disturbances. So, psychological factors includes anxiety and depressions. These are the main causes for sleep deprivations, and in cancer patients, pain also one of the uh, cause that causes sleep deprivation or insomnia in hospitalized patients. Next question. The client with lymphedema has an increased risk of cellulitis and lymphangitis because of. The clients with lymphedema has an increased risk of cellulitis and lymphangitis because of fragility of the capillaries, myelosuppression of the bone marrow, stagnation of the accumulated fluid, increased use of extremity. Please give your answer fast. The client with lymphedema has an increased risk of cellulitis and lymphangitis. Correct answer is stagnation of the accumulated fluid. Lymphangitis and cellulitis due to stagnation of the accumulated fluids because patient already have lymphedema. Infection may occur in a client with lymphedema because of the stagnant accumulated fluid, which becomes an excellent medium for bacterial growth. In lymphedema cases, there will be stagnation of the fluid lymph that will be act as an excellent medium for bacterial growth. So it will cause lymphangitis or cellulitis. Capillary permeability, not fragility, increases fluid in the lymphedema. Capillary permeability, not fragility, increases fluid in lymphedema. Myelosuppression is not related to lymphedema, only to neoplastic disease or secular to treatment of neoplastic disease. So myelosuppression is usually seen with some cancers and also due to chemotherapy, treatment of neoplastic disease. Increased use of extremity may also cause increased accumulation of fluid, but it is not a direct cause of cellulitis and lymphangitis. Next question. A client with a family history of cancer asks the nurse what the single most important risk factor is for cancer. Which of the following risk factors should the nurse discuss? A client with a family history of cancer asks the nurse that the single most important risk factor is for cancer. Which of the following risk factors should the nurse discuss? Family history, lifestyle choices, age, menopause, or hormonal events. Single most important risk factor. So you need to select one of the important risk factors for cancer. Okay, the correct answer is age. Age is the one of the single most important factor that is causing cancer. Because more than 50% of the cancers, 50% of the cancers occurs in people who are older than age 65. The single most important factor in determining risk would be the age. More than 50% of the cancers occurs in people who are older than age of 65 years. So that is the one of the single most important factor in determining risk of cancer. Next question. The incidence and risk of cancer increases when smoking is combined with. The incidence and risk of cancer increases when smoking is combined with asbestos exposure and alcohol consumption, ultraviolet radiation exposure and alcohol consumption, asbestos exposure and ultraviolet radiation exposure, alcohol consumption and human papillomavirus infection. When the risk of cancer increases when smoking is combined with one of the option. The options are confusing, that's why. Okay, please guess your answers. We'll check. Please try to make your answer or guess your answer. Okay. Correct answer is those who are given option A. Smoking with asbestos exposure and alcohol consumption increases risk of cancer. Smoking with asbestos exposure and alcohol consumption increases the risk of cancer. Asbestos and alcohol, when combined with smoking, produce a synergistic effect and result in increased cancer risk and incidence. Asbestos and alcohol, when combined with smoking, produce a synergistic effect and result in increased cancer risk and incidence. Ultraviolet radiation exposure is associated with skin cancer. Human papillomavirus exposure is associated with cervical cancer. However, the risk of contracting these types of cancers are not markedly increased when combined with smoking. So that is important. So smoking combined with asbestos and alcohol, the chances of cancer is increases. Okay, next question. Which of the following terms describes the condition of a client who requires an increase in dosage to maintain adequate analgesia? Which of the following terms describes the condition of a client who requires an increase in dosage to maintain adequate analgesia? Pseudo addiction, physical dependence, psychological dependence, drug tolerance. 14th question. Those who are giving a wrong answer here means they are not attended to the first question. Because correct answer is drug tolerance. Drug tolerance means that patients require increased dosage to get the uh, effective the the similar effect to get the higher dose. That is means drug tolerance. That is discussed in first question. Drug tolerance is reduced responsiveness to the effect of any drug which necessitates larger doses to achieve an equivalent effect of the initial dose. So with example only I have given in first explained the first question. So drug tolerance is a reduced responsiveness to the effect of any drug which necessitates larger or increased dose to achieve an equivalent effect of the initial dose. Pseudo addiction. Pseudo addiction means a term used to describe the iatrogenic syndrome of drug seeking behavior. It is used to describe the iatrogenic syndrome of drug seeking behavior that develops as a direct consequence of inadequate pain management. Physical dependence refers to the state in which an individual must take a substance to feel physically normal. Not taking the drug results in withdrawal symptoms. That is what physical dependence. Psychological dependence means an individual needs to derive an alteration in mood from a substance. Psychological dependence refers to an individual's needs to derive an alteration in mood from a substance. Pseudo addiction means पेशेंट को ज़्यादा मेडिसिन चाहिए, वो उसका पेन मैनेजमेंट और उसका डिसीज़ के लिए वो ज़्यादा दवाई के लिए डॉक्टर को प्रेशर करेगा, वो उसी कंडीशन को सूडो एडिक्शन बोल देता है. बिकॉज ऑफ they usually manage with low dose. So patient will complaints against require more ज़्यादा मेडिकेशंस, उसके लिए सूडो एडिक्शन बोल देता है. सिर्फ पेन के लिए नहीं और कुछ और अलग कंडीशन के लिए भी, अगर बुखार और कफ पेन कॉमन, इसलिए मैंने पेन एग्जाम्पल दिया है. दूसरा कंडीशन के लिए भी सूडो एडिक्शन आता है, लेकिन पेन इज द कॉमन symptoms they are complaining for pseudo addictions. Next question. A 56-year-old female is currently receiving radiation therapy to the chest wall for recurrent breast cancer. She has pain while swallowing and burning and tightness in her chest. The nurse should further assess the client for indications of. A 56-year-old female is currently receiving radiation therapy to the chest wall for recurrent breast cancer. She has pain while swallowing and burning and tightness in her chest. The nurse should further assess the client for indications of hiatal hernia, stomatitis, radiation enteritis, esophagitis. ജാൻസി അജിത്ത് മനസ്സിലാവുന്നുണ്ടല്ലോ അല്ലേ ഇംഗ്ലീഷിൽ? This is another indirect questions. So in previous questions we have discussed one of the similar question related to this radiation. Okay, we'll check the correct answer here. Correct answer is esophagitis. So already we discussed in previous questions the patients who are receiving radiation therapy on chest, they may have dysphagia and esophagitis. That is common because esophagus situated behind the mediastinum. So that is high risk for getting esophagitis and dysphagia related to radiation beam therapy. Difficulty in swallowing, that is dysphagia, pain, and tightness in the chest are signs of esophagitis, which is a common complication of radiation therapy of the chest wall. Hiatal hernia is a herniation of the portion of the stomach esophagus. The client could experiencing burning and tightness in the chest secondary to hiatal hernia, but not pain when swallowing. Dysphagia usually not seen with hiatal hernia. So that is about today this oncological nursing video. So we will discuss more questions in next part. So 9 o'clock we will discuss critical care questions and answers. So I think it will be helpful for you. So please like and share this video and tell your friends to join during 9 o'clock session. Radiation end rate is usually when we are giving radiation to the abdominal wall. So that time radiation end rate will occur. But here we are discussed the patient is 56-year-old patient is getting radiation to the chest wall because she had CA breast, carcinoma of breast. Jinsha Wilson. So please comment your doubts in comment sections. So those who are wanted Rajasthan CHO result, please comment here. So we will provide the link. Saranya Bhaskar, pseudo addiction already explained here. Jansi Ajit, we already discussed the more oncology questions in previous video. Please check there. There are more questions. I think this is my 305th video. So you may get more questions there. So I already made a oncology questions playlist. You can go and watch. Any other doubt? So okay, we'll stop here and we'll meet 9 o'clock. So please stay tuned. We'll meet 9 o'clock with critical care nursing questions and answers. So have a tea and take rest. We'll meet 9 o'clock.